Hello everyone, I am Sagar Kamti. This is seminar on Hodgkins and non-Hodgkins lymphoma. Objectives: definition, incidence, prevalence, classification, causes and risk factors, clinical manifestation, diagnostic evolution, management and prognosis. Introduction: lymphoma is a cancer of the lymphatic system affecting the lymph nodes, spleen and bone marrow. It occurs when abnormal lymphocytes multiply uncontrollably. It is classified into Hodgkin's lymphoma, non-Hodgkin's lymphoma. Hodgkin's lymphoma. Hodgkin's lymphoma is a cancer of the lymphatic system marked by the presence of the Reed-Sternberg cells in the lymph nodes. It usually spreads in an orderly way and presents with painless swollen lymph nodes, fever, night sweats, and weight loss. Incidence and prevalence. Hodgkin's lymphoma accounts for 5% of the childhood cancers. Incidence rate 0.4 to 0.5 cases per 1 lakh children annually. Classification. Causes and risk factors: genetic predisposition, infection, immune system deficiency. Age and gender, geographic and environmental factors, previous cancer of radiation therapy. Clinical manifestation: painless lymph node enlargement. The most common sign is painless, firm, movable lymph nodes, especially in the cervical or supraclavicular areas. Affected areas: lymph nodes in Waldeyer's ring, cervical, supraclavicular, axillary, inguinal, mediastinal, spleen and liver are commonly involved. Mediastinal lymphadenopathy may cause a non-productive cough and shortness of breath. Systemic symptoms includes fever, anorexia, weight loss, night sweats and pruritus, typically indicating advanced disease. Diagnostic evaluation: complete blood count, uric acid levels, liver function tests, ESR. CT scans, gallium scans, lymph node biopsy, bone marrow biopsy. Management: chemotherapy. Doxorubicin and vinblastine are key chemotherapy drugs used in treating pediatric Hodgkin's lymphoma. Radiotherapy used for localized disease or after chemotherapy. Surgical intervention: splenectomy is done if they are involved. Combination therapy: a combination of chemotherapy and radiotherapy is done. Supportive care given in order to manage side effects. Follow-up and surveillance to monitor for relapse and side effects. Psychological support to address emotional and psychological needs. Immunization given splenectomy or chemotherapy. Nursing management, assessment, pain management, chemotherapy, radiotherapy care, infection prevention. Psychosocial support, nutritional support, educational health support, monitoring complications, post splenectomy care. Hodgkin's lymphoma has a high survival rate with long-term remission, possible even in advanced stages. Hodgkin's lymphoma. Non-Hodgkin's lymphoma is a type of a cancer that benigns in the lymphatic systems, involving uncontrollable growth of lymphocytes, a type of white blood cells. It differs from Hodgkin's lymphoma in that it does not contain Reed-Sternberg cells. Incidence and prevalence. Non-Hodgkin's lymphoma affects approximately 5 lakh people worldwide, with rising incidence, especially in developed countries. The incidence rate is 19 per 1 lakh people annually. Classification: histological classification and immunologic classification. Histological classification: lymphoblastic lymphoma commonly affects the mediastinum and bone marrow. Burkitt and non-Burkitt lymphoma commonly affects the abdomen, jaw or CNS. Large cell lymphoma, it affects various organs. Immunologic classification: B cell lymphoma, T cell lymphoma, non-B, non-T cell lymphoma. Causes and risk factors: weakened immune system, viral infection, genetic mutation, exposure of radiation and chemicals, previous cancer treatment, age and gender. Clinical manifestation: swollen lymph node, bone marrow and CNS involvement. Abdominal symptoms may lead to pain, vomiting, diarrhea or intestinal obstruction. Chest involvement may cause cough, breathing difficulty or chest pain. Spinal cord compression may lead to back pain, weakness or paralysis. Burkitt lymphoma features: fast growing mass in the jaw, abdominal, eye socket. Clinical manifestation: organ enlargement, liver, spleen, or kidney may be affected. General symptoms like fever, night sweats, weight loss, and fatigue. Diagnostic evolution: lymph, lymph node biopsy, bone marrow aspiration, CT scans, MRI, PET scan. Blood test: lumbar puncture, chest X-rays. Chemotherapy, radiation therapy, lymphoblastic lymphoma treatment, non-lymphoblastic lymphoma treatment, CNS prophylaxis, supportive care, long-term follow-up. Nursing management: monitor for signs of infection, ensure proper nutrition, monitor for bleeding, provide emotional support, manage pain and discomfort, educate family. Prognosis: childhood non-Hodgkin's lymphoma has a more than 80% 5 years survival rate with advanced treatment. Early stage has a better prognosis, advanced stages need aggressive therapy. Both Hodgkin's and non-Hodgkin's lymphoma have improved outcomes with modern treatment, with Hodgkin's having a better prognosis in early stages. Early diagnosis, aggressive treatment for non-Hodgkin's lymphoma, and long-term follow-up for crucial for survival and managing late effects. Thank you.